Hello, my name is Jung Clinical Fellow of the Borame Medical Center. I am the co-first author of the article named Targeted Next Generation Sequencing for Locally Advanced Prostate Cancer in Korean Population. Another co-first author is Chang-Wook Jung, the Associated Professor of Seoul National University Hospital, and the corresponding author is Chol Kwak, the Professor of Seoul National University Hospital. Targeted next-generation sequencing, which called as cancer panel, is promising tool for clinical application of precision medicine in real-world practice. Recent large-scale landmark genetic studies such as TCGA revealed the genetic background of many tumors. However, it contained only limited number of Asian data. By the other hand, the clinical behavior of prostate cancer in Korean are different with Western population. Lesser incidence and more aggressive behavior of Korean prostate cancer may be based on genetic difference with Western population. For this reason, we performed the pan-cancer panel assay for locally advanced prostate cancer in Korean population and compared the TCGA data for revealed genetic difference. Seoul National University Hospital Cancer Panel, the name the first panel was used for this analysis. First panel contained 183 exon and 23 fusion gene and 30 promoter region, 8 MSI marker, and 45 drug target genes. It also contained 40 prostate cancer specific mutations. 20 locally advanced prostate cancer patients were selected from prospective registry of radical prostatectomy of our institute. Study was performed by following flow. We used 20 patient fresh frozen tissue and successfully extracted DNA from the all patient samples. Library prep and targeted sequencing was performed by standard method. We compared the first panel results with TCGA prostate cancer data, and we performed univariate and multivariable analysis with clinical parameter and genetic mutation data for biochemical recurrence. Baseline demographics of enrolled patients was shown in this table. Median age was 69 and PSA was 66.3. 9 patients were pathologic T3B and others were T3A. 85% of patients were performed pelvic lymph node dissection and 5 patients were pathologic N1. The average follow-up period was 25.6 months and 14 patients were shown biochemical recurrence within follow-up period. Average sequencing cover uh, 9, 560, 74.5 and we found in 99 mutations by first panel. SPAM mutation was most common and ETS fusion found it in 20% of patients. SPAM mutation and ETS fusion were mutually exclusive. We selected 10 most common mutations and some gene of interest from first panel and compared the incidence of these mutations in TCGA database. SPAM mutation and KMT2D were frequently found in TCGA data, but other mutations were found in less than 5%. Among these mutations of higher incidence in this study than TCGA, BRAM mutation was only proven pathologic mutation. We performed univariate and multivariable analysis using clinical parameter and genetic alteration for assessing risk factor of biochemical recurrence. Prostate volume less than 50, pathologic Grayson grade over 4, and BRAM mutation shows statistically significant association with biochemical recurrence by Cox proportional hazard model. From this study, we successfully analyzed targeted NGS in all 20 patients with good sequencing depths. By compare with TCGA data, we found both similar and different findings. SPAM mutation, KMT2D mutation, and ETS fusion were common in both groups. SPAM mutation and ETS fusion were mutually exclusive in both groups. Some mutations were more frequently found in this study. However, only PRAM mutation was pathology. From multivariable analysis, PRAM mutation shown statistically significant association with biochemical recurrence in this study. In conclusion, pan-cancer panel including prostate cancer-related gene is useful tool for evaluating genetic alteration in patients with locally advanced prostate cancer. Our results suggest that the PRAM mutation may be associated with biochemical recurrence in the Korean population. Nevertheless, a well-designed large-scale investigation is needed. Thank you for listening.